TLJ, Florida Palms West Hospital, and I am a CAT scan technologist.
And I am Nikki Iman from HCA Florida Palms West, and I'm a CAT scan technologist also.
So CAT scan stands for computerized axial tomography, and in a sense it's like a loaf of bread where we take a slice out and look at the individual slice. So we're kind of cutting you up like a loaf of bread.
And in those slices that she was talking about, the loaf of bread, we can diagnose, the doctor can see if you have a mass, if you have bleeding, if you have anything abnormal in your x-ray. A typical day in CAT scan, we do a wide range of patients from emergency room to outpatients to inpatients. A scan usually only takes a minute and a half to 5 minutes total, unless we're doing a biopsy or a procedure with a radiologist, and that takes a little bit longer. When the patient comes in, we put the patient on the table, and the patient goes in. As the camera's going around, we are taking the pictures, and then you come back out, and we might have to do IV contrast on some patients if the doctor specifies that, and then you'll go back in as we're injecting the contrast, and when we're done injecting, you're all done. It takes about a minute and a half to 2 minutes.
So while the patient's on the table, we're in the back running the machine. During the running of the machine, the images do populate up onto the screen for us to see. After the initial scout films that we take, we tell the machine what area to actually scan, and if it is with contrast, we start the IV contrast, so we come into the room to do that. It usually makes the patient feel warm inside. Most people don't have any other issues with it. Once the images are done and the patient is done, those images get processed and sent to a radiologist, and there is a reading done, which gets done on a paper as a report and either sent to the physician that ordered it or the emergency room. Okay, so what to expect when you come to have a CAT scan is you come into the room, you can lay on the table, depending on which body part we're doing. We either put you head first or feet first. This is called the gantry. The table goes up and down and also goes in and out. The area that does the imaging is in the center here, so that's where the patient has to be to get the imaging. And essentially the machine will ask you to hold your breath or tell you when to breathe if we're doing an abdomen, pelvis, or a chest. Other than that, we usually breathe normal. And you just go in and out. To get into this career, you don't necessarily need to go to a 4-year college. They have 2-year programs where you get certified. You have to be a radiology technologist first before you can move on into other modalities in the imaging departments.
If you decided to go into the medical profession and wanted to do x-ray, you have to do your 2-year x-ray with some prerequisites, some anatomy, some physics to get into x-ray school. And once you're into x-ray school and you graduate, there's usually a program to go for CAT scan. It's usually 6 months, and do on-the-job training. If you really like the technical, or MRI, same thing. It's the 6 months to a year to get an MRI. But each year we're advancing, and every day we do new things. It's never the same. Every patient's different. You get your frequent patients that you get close to, which is nice.
So for those of you that are considering a career in imaging, you can actually start taking classes still while you're in high school. They have dual enrollment in colleges if you have good grades. They have college courses in the high schools nowadays to help you get started. So once you jump into possibly that 2-year program, you can get on with your career. And don't let the cost of tuition deter you from following up in this career. There's lots of programs out there to help you. One being the T. Leroy Jefferson Medical Society. And there's also many more that will help you with grants, scholarships. So there's lots of programs out there to help you